dengue as our topic. Let me introduce our team members. They are Salima Nur Syahidah binti Salimi, Nora Idayu binti Zakaria, Nur Syahira Bakri, Nur Maisarah binti Adi, and including me, Nur Zaitan binti Abdul Razak. First of all, do you know what is the dengue?
Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. I'm Syahira binti Bakri. I'm representative from Group 5 for SCE 552 Science, Technology and Society course. Our lecturer, Dr. Sharifah Ruzaina, asked us to make a video, to make a documentary. We are free to choose any topic or any issue as our documentary's topic. In earlier this video, we told you that our topic is dengue. Why we choose dengue as our documentary's topic? Dengue actually is one of the most crucial health problems, not only in Malaysia but several countries of the world. WHO, World Health Organization, states that about 125 of countries in the world facing dengue as a crucial health problem in their countries. The countries include Colombia, Nigeria, and also Malaysia. Because of that reason, we choose dengue as our documentary topic. Our hopes, hopefully through this documentary will increase the awareness of the society about the dengue disease. The content of this video, you will watch it later. To make this documentary, we use two methods to collect the information, the material we need in this documentary. The two methods are by observations and also by interviewing the people. We observe the surrounding. We interview the people related to our topic. Want to know our findings? You guys better watch out our documentary.
This is the life cycle of Aedes. At the beginning, mosquito hatch eggs on water. Then it turns to larva, comes out a bit in water, which does not look like a mosquito at all. After that, it develops into a pupa. And lastly, it grows, becomes an adult.
Okay everyone, in previous part of this documentary, you already know about the Aedes. You already know how it grows. You already know the Aedes life cycle. It grows from the egg until the adult mosquito. And this becomes the vector to transmit the dengue virus into the human body. You already know about the term dengue fever, about the term dengue virus. But actually, did you guys know what actually dengue is? What the history behind it? Let's watch what people know about the dengue.
What I know about a dengue is a disease that causes from a mosquito, and we will get a fever for a long time.
My name is Habibah binti Sarwan and I'm from Education in Physics.
Okay, did you know anything about dengue?
Okay, what I know about dengue. Dengue is one of the serious disease in Malaysia right now. And as I know, there are two types of dengue fever, which is dengue fever and severe dengue fever.
I have known about dengue is a disease caused by virus that transmitted from mosquito bites.
I have known that dengue is the infection caused by the dengue virus that bite from the species mosquito called as an Aedes.
Previous part of this documentary, we already shown you about the term dengue, about the term dengue virus, and also about the term dengue fever and what is Aedes. Dengue is a disease caused by the dengue virus and lead to dengue fever. Aedes become a vector to transmit the dengue virus into the body. When we talk about the sickness or disease, we need to know the symptom of the sickness or disease. So, when we talk about the dengue fever, this disease also have a symptom. What is the symptom of the dengue fever? Let's check it out.
Dengue can cause high fever, intense headaches, muscle pains, joint pains, nausea and vomiting, and skin rashes. The disease can be very painful. A few cases can develop into life-threatening dengue hemorrhagic fever, resulting in bleeding, low levels of blood platelets, and blood plasma leakage. It can also result in dengue shock syndrome, where blood pressure can drop to dangerously low levels. Severe cases, if left untreated, could result in death.
Can you tell us about the symptom of dengue patients?
Okay, the symptom of dengue patient is first the patient will experience headache, runny nose, muscle and joint pain, loss of appetite, diarrhea, vomit, and the last is bleeding.
Okay, did you know any symptom of dengue fever patient face?
Actually, there are many symptoms for dengue patient, such as red spot, joint pain, vomiting, headache, and for serious dengue patient, the patient will got a bleeding.
One of the symptoms is a fever, long fever, that cause temperature of our body will rise to 40 degrees Celsius. Second symptom is a red spot that appears in the patient's skin, and the others is severe muscle and joint pain, and also bleeding gums.
Since earlier of this documentary where they show you how the Aedes grow, we already showed the symptom of the dengue fever as well. But actually, how the dengue virus can be transmitted into the human body? Give me 5 seconds to recall. No, 10 seconds to recall. I think I can't remember. I couldn't recall it. If you want to know how the dengue virus transmitted into the human body, watch this.
Transmitted by mosquitoes, dengue fever is a threat to almost half of the world's population. Dengue is a major public health problem, particularly in Latin America and Asia, where outbreaks occur regularly. When biting a person for its blood meal, an infected mosquito releases saliva containing the dengue virus. Once in the body, the virus infects the immune cells in the skin tissue. And enters the lymphatic system. The viral infection can then trigger a strong inflammatory reaction. During the incubation period, the virus first replicates locally. And then spreads into the bloodstream of the infected person. This is called viremia. For some patients, especially children, the infection may cause severe forms of the disease, including dengue hemorrhagic fever. The blood vessels become permeable, resulting in plasma leakage. Ultimately, dengue hemorrhagic fever requires intensive hospital care. When a mosquito bites a person who's already infected, it draws in the dengue virus contained in the blood. By biting another person, it can transmit the virus and spread the disease.
How long you have been experienced facing the dengue patient?
Almost 3 or 4 years.
Okay. how someone can be detected as a dengue patient?
Usually, the patient who got dengue fever, the symptom we can see from the patient. The patient got high fever more than 3 days. Patient got headache. Patient got muscle ache pain. And patient also got eyes pain and so on.
Okay. What about the treatment that can given to the dengue patient?
The treatment we give to the patient who got dengue fever, like a drug, we usually use ibuprofen, but sometimes we use aspirin. But most of the time we use ibuprofen because the aspirin can cause the bleeding for the patient, because patient who got dengue fever also can got bleeding.
Okay. Can I know the age range for the dengue patient that commonly come to the hospital?
Usually, we can see that most of the patient got dengue fever from the age 18 to 25 years old. That means teenager most of the time who got the dengue fever.
The teenagers. Okay. How long the dengue patient will be hospitalized?
Not all patient dengue will be hospitalized, because those who patient got dengue fever still in stable condition, we just observe first. Then if getting worse, maybe the patient will be hospitalized, because the dengue fever most of the time patient will recovery as fast as her or his antibody immune to the dengue fever.
Okay. Have you been infected by the dengue?
Yes, I have been affected by dengue before.
So can you tell me about your experience when you faced the dengue?
Okay, my experience occurred last year, if I'm not mistaken, during Ramadan. It is occur when after I break my fasting. At that time, my body get cold all of a sudden, and I doesn't think that it is a symptom of dengue fever. I just ignore it. But after I finish my prayer, my body temperature get increased rapidly. If I'm not mistaken, 38.7 degree. I'm just take Panadol as usual, because as usual when I get fever or headache, I will take Panadol. After that, my body temperature is still the same. It doesn't show any changes. For the day 3, I got fever. My sister asked me to see a doctor, and he said that I get virus fever. After a week, doctor has confirmed that I already diagnosed from dengue fever, and I has been warded in hospital Ampang for a week. In hospital, I also use traditional methods to get recover, where I eat crab soup that my family bring to me, and after that my blood lab turned to normal, and I have been discharged from hospital. Okay, that's all.
Okay, thank you.
Can you tell us the action that you can do to prevent the dengue disease?
Okay, the action that I can do to prevent the dengue disease is, firstly, I have to make my environment surrounding me keep clean. Then I have to remove the stagnant water from all tires, waves, and remove the clothing in the drain.
The action we have to take to overcome the dengue is clean up our house inside and outside and put away a container that may causes the mosquito to lay their egg.
As we know, we must clean up our house and empty stagnant water from old tire and stained cans.
Can you tell any action that you can take to prevent the dengue disease?
Okay, I think the usually common action that people do right now is remove the staining water from vest, old tire, and others place that fill with water. Maybe.
This is serious matter. Dengue is one of the health problems that can lead to fatal, but there is no vaccine to cure it. In Malaysia, there are exceed 50 people die before of the dengue per year. Since 2012, there are increasing of dengue cases reported. As time passes by, dengue become more serious. To overcome it, we need to take actions. Government play their role to overcome the dengue disease. Medical practitioners and scientists always do their research to produce a vaccine and medicine to cure the dengue disease. So, as the good member of the society, what we can do, what we should do, and what we could do, what the action that we can take. Worst case can occur. It can cause us fatal. We've shown you can prevent or overcome the dengue disease from becoming worse. Ensure your environment keep clean. With tiny care, you can save thousands of lives. Earlier I said, I use observation and interviewing as our method to collect our information. So, I think you can see our finding throughout our observation and interviewing in order to make this documentary. Hopefully, this documentary will give you the information about the dengue issue. Once again, with your tiny care, you can save thousands of lives. Thank you.
Thank you for your attention to watch our video. I think that's all from us. Assalamualaikum.